concern is always their child's health and safety, so it's always so important to make sure that you're responding correctly when your child gets a fever. Dr. Theresa Horton, a pediatrician from Utica Park Clinic in Owasso, joins us today to talk more about this. You said a moment ago, this is one of the #1 things parents, bring their children into the doctors when they have a fever. So it's important to know how to react when your child may be spiking a fever. What would you consider? Let's start very basic. When is the time to maybe consult the doctor when someone's child has a fever?
Well, first of all, it's important to know what a fever is. So a temperature of 100.4 or higher is when we'll consider that the child actually has a fever. And we also look at the child's age and at the big picture. So if your child is under 3 months, we're going to be much more interested sooner. And if they have a true fever, then we need to know about it, and they should probably be seen sooner. If your child's older and is acting fine and is not very sick, you may give it a few days before you have an appointment. If they aren't getting better, then you would want to be seen. And of course, the higher the temperature goes, the more we get interested in why do you have a fever. We don't worry that the fever itself is going to hurt them, but we do get more interested in why.
When would you recommend introducing medication? Do you let the fever run its course? When do you make that decision as a parent to say, okay, well, maybe it's time to give them something?
We really recommend on looking at how the child's feeling and how they're acting. So the fever itself does not have to be treated. Fever will help fight the illness. So if the temperature is low grade and the child is acting fine, it's good to let the fever run. It can help shorten the course of the illness. When your child's temperature gets higher, especially if it's 102 or higher, that can make them uncomfortable. So we recommend treating it, but we're treating the child's comfort and not the number on the thermometer.
Okay, is it possible to overtreat a fever?
Well, of course, we do want to bring the child's temperature down if it helps them to feel more comfortable. But like I said, we can shorten the course if we let the fever run. And of course, if you use too much medication, then you can look at more potential side effects of using the medication. It could be stomach upset or irritability for some kids.
It could introduce a whole other set of symptoms, and I'm sure that could increase the parent's anxiety. What would be the best way to take a child's temperature? We know that there are several methods. What's the best, or what should people do?
So it's hard these days to know because there's so many different options out there. And most of the time what I recommend is just what's easy and makes your child more comfortable as far as method. And there are benefits for each type and of course pros and cons for everything. So the most accurate temperature is rectal, but that's a difficult thing for most parents to do, especially once they're mobile. Oral is also a little more accurate, but you have to have an older child that's cooperative. As far as the other scans, the forehead scans, temporal scans, the ear thermometers, or the underarm, they're not quite as accurate, but they're usually close enough to know if your child's temperature is low, medium, or high. And it's helpful for parents to understand that if you are using an ear thermometer and there's earwax, that may vary. If you're using one of the scans, if your child is sweaty, or if you were just outside, or if you were bundled up really warm, then that can change the skin temperature a degree even. So if you're doing underarm and you have a wiggly child who's been bundled warm, then it might not be as accurate. But at least we can get close, and that's helpful information.
Sure. Well, as a parent, you always want to do the right thing, what you're comfortable with, what's best for the child. How do you have those conversations with a parent on what to do when it comes to something like this?
I recommend that they look at the big picture, and fever is one piece of that picture. So is your child's temperature low, medium, or high? Are they acting okay? Are they acting lethargic? Are they eating okay? Are they not eating? Are they having trouble breathing? And when you start adding more and more concerns in, then it's really best to check with your doctor.
Sure. Always great advice. Thank you so much for being here today.